Hi, I'm Dr. Elaine Wittenberg. I'm an associate professor in the Division of Nursing Research and Education at City of Hope Comprehensive Cancer Center in Duarte, California. My area of research focuses on communication and specifically communication in hospice and palliative care. For the last 10 years, I've been researching healthcare teams and nurse communication training and developing nursing interventions for family caregivers. Communication in palliative nursing is extremely important for several reasons. First, pain management requires skillful communication to assess for pain, to explore any fear of addictions. And secondly, communication is very important because nurses require skillful listening and compassionate care when working with family caregivers who are dealing with a new diagnosis or news that prognosis is very poor. And then finally, communication in palliative nursing is important because it requires teamwork, and teamwork requires excellent communication skills. And teamwork also means caring for yourself as a team member. So there's several different dimensions to communication when we think about palliative care communication in nursing. Historically, nurses have not received quality communication training in their undergraduate or graduate education. About 15 years ago, the ELNEC Project was born, and it was one of the first programs to offer any sort of communication training for nurses, specific to end-of-life care. Of course, as you know, in the ELNEC modules, we have 1 hour devoted to communication training, and for the last 15 years, this is the only training that physicians have received. Now, communication in healthcare has been on the radar in policy and in educational improvement projects. Unfortunately, though, we've primarily focused on physicians and the physician's role in communication in healthcare. And more specifically, that area of training has focused on how to train physicians to deliver bad news to patients and to families. But we know that the nurse has a quintessential role in that process as well. So in the last 5 years, we've begun developing communication training programs that focus more specifically on the nurse's role. The nurse's role is very unique. Nurses are very vulnerable to patients and families. They do not have a controlled communication environment where they can walk in, deliver news, and then walk out. Communication opportunities are very different for nurses in that patients and families approach them when they feel it's the time to talk about certain topics. And sometimes nurses are caught off guard, and It's not surprising that communication is one of the most popular modules in the ELNEC curriculum. Nursing requires excellent, skillful, relational communication skills. Nurses are unique in that they develop relationships with patients and family members, very unlike physicians and other members of the healthcare team. Nurses are the front lines of care across diseases, across clinical settings. They are there to provide support to patients and family members as they digest information, news of diagnosis, news of poor prognosis. They are the advocates for the patients within the healthcare team, and they are often the mediator amongst family members as family members try to assist the patient in making decisions about treatment or about hospice and palliative care. Nurses should reach out and explore the communication resources and tools available to them. And the ELNEC module on communication certainly has a number of resources to help you improve practice in this area.